Question number 2, the Honourable Annette King.
Thank you, Mr Speaker. My question's to the Minister of Health. What advice has he received on the health budget for 2015-16?
Speaker.
The Honourable Pesata Sam Lotu-Iiga.
Mr Speaker, on behalf of the Minister of Health, the member will be aware that the details of Budget 2015 and the evidence and advice that sit behind the budget are confidential until the budget is announced in May. I've received a range of advice that will inform the thinking of the Cabinet for the budget in May.
Supplementary question, Mr
Supplementary
Speaker.
question, the Honourable Annette King.
Was the funding signal given to DHBs to ensure they can complete their first draft of their annual plan by March $250 million as recommended by Treasury, or $320 million as proposed by him in the paper to Cabinet in December last year?
The Honourable Pesata Sam Lotu-Iiga.
Mr Speaker, nothing has yet been decided on the health budget, and the paper leaked to the member has never even been considered by Cabinet. There have been no cuts, and the government has increased the health budget by an average of $466 million per year since we've been in office, and we've seen consistently improving results across the sector. So this year we'll see further increases in the health funding, and we expect even better results for New Zealanders. By contrast, the member doubled the health budget and was still culling people, waiting lists.
Well, there's no responsibility
Supplementary
there.
question, Mr Speaker.
Supplementary question, the Honourable Annette King.
Does he stand by the advice he was going to give to Cabinet but hasn't given yet, that the signal of $320 million to DHBs for 2015-16 will, quote, and this is a quote from the Minister, will make it extremely challenging to manage the pressures in vote health? If not, why not?
The Honourable Pesata Sam Lotu-Iiga.
Mr Speaker, on behalf of the Minister, I stand by all my statements. And I stand by the statement that in the last year, funding has increased by $327 million to all the district health boards across the nation. And sir, what this government is not going to do with the budget is double the health budget, but see deficits blow out by $155 million as it was under that member's tenure.
Supplementary, Mr.
Well, the DHB's blowing out right now.
Supplementary question. Oh, there we go, the old dried arrangement.
Order. I haven't yet called the member. Order. Supplementary question, the Honourable Annette King.
Mr Speaker. Is his recommendation to Cabinet that 20 DHBs share $86 million to address the cost pressures they face in 2015-16 sufficient to meet wage pressures, which he stated in the Cabinet paper he hasn't given to the Cabinet yet, were estimated to cost $50 million for just a 1% in wage pay increase for our hard-working health workers?
The Honourable Pesata Sam Lotu-Iiga.
Mr Speaker, obviously a number of employment negotiations are taking place, and I, on behalf of the Minister, am not going to prejudice the government's position by discussing those negotiations. But suffice to say that the member is wrong again on those facts.
Point of order, Mr Speaker.
Point of order, the Honourable Annette King.
Mr Speaker, I've just been challenged on the facts I use. Can I seek leave to table the Cabinet paper that he hasn't released that has those figures in them?
Order. Order. Leave is sought to table that particular paper described by the member. Is there any objection to that paper being tabled? Yes. There is.
They don't like the truth. Supplementary question, Mr Speaker.
Order. Supplementary question, Barbara Stewart.
Thank you, Mr Speaker. Will Budget 2015 rectify the increasing trend of patients being discharged untreated by our hospitals, which in many cases has doubled under this government?
The Honourable Pesata Sam Lotu-Iiga.
Mr Speaker, sir, as I've stated in my previous answers, that the funding for the health budget has increased over $466 million per year on year since this government took power. So that will see further increases in our health funding relating to both elective surgeries and other services to the communities.
I can anticipate the point of order that's coming. I'm going to invite the member to repeat that question for the benefit of the Minister.
Thank you, Mr Speaker. Will Budget 2015 rectify the increasing trend of patients being discharged untreated by our hospitals, which in many cases has doubled under this government?
The Honourable Pesatara Sam Lotu-Iiga.
Mr Speaker, on behalf of the Minister, I have not been briefed on those specific facts, but if you'd like to make a written question to the Minister, we will answer it in due course. Thank you.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette.
Acting Minister, how much of the $86 million signalled to cover cost pressures across all DHBs will counties Manukau receive in light of their chair, Lee Mathias, stating on Tuesday this week that their DHB alone is predicting a shortfall of $100 million, just one DHB?
The Honourable Pesatara Sam Lotu-Iiga.
Mr Speaker, as I said in the response to the primary question, I cannot make available the details of the budget 2015 because it is confidential until the budget is released. But what I can say about the county's Manukau District Health Board is that they received in the last financial year $1.33 billion worth of funding, and that, sir, is an increase of $311 million since this government took office.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette.
Is the Acting Minister aware that counties Manukau have been told that they would get $23.61 million for 2015-16 when they are predicting a shortfall just of this year alone of $35 million?
The Honourable Pesatara Sam Lotu-Iiga.
As I've already said to that member, and that member knows the budget process, I cannot release that figure. But what I can say, sir, is that since this government took office, there are now 220 more doctors on the front line. There are now 433 more nurses on the front line in County's Manukau District Health Board. And, sir, there is now, in terms of orthopaedic surgeries, there are more patients that are operated in the County's Manukau District Health Board region. And that member should know all this.
Question number 3, Scott Simpson.